This is HealthTech Pulse Talks, conversation from inside a team that shipped 75 plus HealthTech products. I'm Piotr Zając, HealthTech Director at Monterail. Today with Michał Nowakowski. Hi Michał, AI Solution Director at Monterail. We are talking about why AI adoption is at an all-time high, patients' trust is at an all-time low, and why that's not a communication problem, it's a product failure. So Michał, I came across two surveys published a week apart this year. One from NVIDIA, State of AI in Healthcare 2026, said 78% of health organizations are using AI, 85% are increasing budgets. But the other said patients' openness to AI in healthcare dropped from 52% to 42% in 2 years. That's Ohio State Wexner report from January 2026. When you saw that, what was your read?
Definitely wasn't surprised that there is the surge in the usage. However, this being correlated with the drop in trust shows that something is really missing, because the budgets are improving, and usually you would expect that the service would become more and more professional. So here, I believe there is a problem with the idea of how we actually build in the first place. It must be something missing within the product space, something missing with the architectural space. Because everyone heard about hallucinations, but almost no one heard about machine learning operations and evaluations.
So it's actually not a communication problem, right?
There is a communication angle to it, but I believe it's really, it could be easily solved, right? As easily as it all engraved in common consciousness. I believe once it's solved at the core, so we all, as the users, as the builders, grow more and more confident that with the right architecture and with the right approach, we can make sure that none of these errors or anything that is really damaging the trust in the long run, we could quickly forget about it and focus on what's really important. So taking the upside of the technology and actually making it more useful for everyone that's using it, right?
So the instinct is that the industry is, let's communicate better, let's do the amazing, the most successful FAQ page, update the onboarding flow, let's add several different screens to make those sexy checkboxes. And you're saying that's the wrong fix, right? This is what I took from what you said. And why is that?
Yes, and I was just trying to be nice about it, but you hit the nail on the head with this one. Yeah, FAQs can help, obviously, but again, if the problem is at the core, so whenever things related to things like privacy, explainability, or the clear functioning of the AI-enhanced systems are an afterthought, or something that gets assigned to the marketing team to be done once the product is launched and once we already have some traction, then you're actually starting to work against yourself, right? Because you're trying to put a nice face to something that you really didn't do. And here you're managing very sensitive data, not only personal data, but also medical data, anything that will be used for future diagnosis. And you don't want this data to be meddled with, you don't want this data to be malformed in any way.
Yeah, so we are talking about something that we should call by design, right? We should think about AI in healthcare products by design from sprint zero, or even before we think about sprint zero. But let's look at it from a little bit different angle. So maybe patients or users, it depends on the type of the product, maybe they don't actually want to understand the AI. Maybe they just want to get better outcomes. Is explainability something product teams care about more than patients do? Like, what's your take? You're analyzing AI products and different layers of AI all the time. So what's your take on it?
When I think about it, definitely it depends on the timing because at first the product team is not very much interested in this because explainability when you're developing an AI system
Mm-hmm.
is not helping you at the beginning because you don't have the result data to benchmark yourself to see where you're at, where you're coming from.
Mm-hmm.
But as your product grows and your user base grows as well, then you can see that there's more and more data you can actually use to improve your product, to also see where you're failing and where you're not failing, whether some of your statistical models are overfitting and some are not, and some are degraded and some data is drifting. This is something where explainability becomes very useful in the further development of the product where your
Mm-hmm.
first strength, so having AI features within your product, is actually not only good for you in the beginning, but throughout entire product cycle. So whenever you need to reiterate, whenever you need to grow, your model or your AI features don't hold you back because you know what's going on.
Mm-hmm.
So I believe that the main thing is that so much of this work happens in the back. So much of it is invisible. You're right, people mostly care about outcomes, and I do too. However,
Mm-hmm.
whenever you're working with this, you know that the outcomes are not the only thing you should be worried about. Because again, they might be good now, or there's this sort of a weird thing where every part of result looks good, but the way you achieved it is not actually good. And
Mm-hmm.
it will surprise you later on when the model or the performance will start to degrade.
So, because the outcomes can be different at different stage of the product lifecycle, right? So, we're saying that it's an architecture decision, and we should start thinking what we want to collect and how do we want to collect it. And it makes it even more urgent when it comes to the submission, which is where it gets expensive. So FDA and European Union MDR, they have specific requirements around AI transparency for software as a medical device. How many early stage teams building health AI actually know this before they start?
From the experience that we've had, there's a clear split that if someone is coming from an area of study that's related to some of
Mm-hmm.
those, they usually know that
Mm-hmm.
you need to jump through some hoops with development of any type of software as a medical device. The other group usually comes from the field of necessity when they know something is really necessary, or they're just very operationally adapt and they see inefficiencies in the system. So then they focus on how to actually improve it. But here, yeah, one more thing is that here I feel like they know about it, but almost no one realizes how important is this to really care about this from the very beginning. Because it's not just something that you need to keep in the back of your head. This is a deliverable. You need to do it. You need to file these documents. Otherwise, you will be taken down or you will have to face
Mm-hmm.
penalties, right?
And we're in European Union, so the hot topic right now is the EU AI Act, and it will put even more responsibility on the owners and the startups and the founders and the teams on the transparency, traceability matrix, and all of that stuff. And so if the team realizes that at sprint 30 that the explainability isn't baked in, this is when it gets super expensive to figure it out how to change it and how to maintain this, let's say, challenge, right?
100%. Here, I'm often wondering what are the nooks and crannies of these documents and whether the timelines for it are realistic or not. Maybe there's some wisdom in putting some leeway on how to
Mm-hmm.
be retroactively compliant to allow companies to move further and then to file compliance without shutting operations down or without too high penalties. These are the details of it, right? And this is the topic for the lawyers. From my perspective, there are some things that are more difficult, but honestly, it is mostly about responsible design of the systems.
Mm-hmm.
So something that we were already doing. This might be surprising for many, but again, I'm gonna be blunt here. There are projects in this world, in the software world, that can be done in a hacky way, but honestly, would anyone want to have their medical products be
Mm-hmm.
done in a hacky way? I don't.
Yeah.
So here I feel like baking in this responsibility from the very beginning and doing it even with a little bit of force is actually something that we'll be grateful for in the long run. While actually there's this operational side to it, because I explained the strategic, the
Mm-hmm.
operational side to it is that how is it really enforceable and whether it's going to stop many companies from doing it.
Mm-hmm. So I'm very curious, like from your perspective and your experience, what's the earliest signal that a team has gotten this wrong?
That's a good one. Here I need to think how to anonymize all these cases because
Yeah.
we're responsible adults here. I feel like I feel like something that we already mentioned. Software as a medical device. The simple term is often the dead giveaway or like a very easy heuristic to see if someone even researched the
Mm-hmm.
field, because this is the key concept here, right? There's this heuristic about whether the software will be used to manage data or whether it will be used to perform diagnosis or medical procedures. So
Yep.
this clear split is something that is a dead giveaway on whether someone is already familiar with the topic or they're fresh in the
Mm-hmm.
field. And even when they're fresh, it's most welcome to educate ourselves, right? Then in this scenario, I feel like if we were to go deeper, um, also knowing the basics of actually computer science and building infrastructure is also helps, because this is something that you would learn as a medical product founder from reading of the stories of how different companies did it
Mm-hmm.
and what were their challenges, because sometimes you can read engineering blog posts about it.
Yeah. Yeah, so we're getting back to this by design term, and we need to define from the very beginning if it's a companion app that it's only showing up some dashboards and data, or if it's an app that helps you to diagnose and to give you some insights, not insights, but some recommendations, and if it's a software as a medical device. So here's what I found interesting about this NVIDIA data. So the highest ROI use cases are virtual assistant, chatbots, admin workflows. So it's all backend and it's all invisible for the patient. Is that a coincidence in your opinion or not?
Hmm. That's interesting. That also converges with the point that most of the work right now is almost invisible because we
Yeah.
try to make all the interfaces as easy as and as
Mm.
minimalistic as possible. So we have the Google-like interfaces, just type in what you need and everything will be there. That's one thing. And then on the other side, to provide the ability to it, you have to process a lot of data in the back. You need to move all the processes in time, so all this data is in time. There's a huge amount of not only data but work to be done. So I believe that from the perspective of the organization, they're optimizing for something that you as a patient don't ever see. Because first of all, they're not only medical organizations, they're also businesses. That's one thing. And they need to report as a business to whoever they need to report, either private shareholders or public market. That's also something that you need to consider. And then I believe that, these are also the areas where it's the most visible in terms of results, and it's also relatively risk-free to try.
Yeah, because we cannot forget that every solution that we are building for the market, the healthcare market, health tech market, healthcare market, should be aligned with patient, payer, providers' needs. And we have this triad that we need to think responsibly about it. And in my opinion, it doesn't matter if it's the US or European Union, because in the US we have multiple different multiple different payers, as well as in Europe. But the payers in Europe are governments, and in the US are private companies. But it's all about the same way: how to maximize the outcome for the patient, and how to minimize the budget and spendings, right, for the payers. So it's all about the outcome for all three parties in this equation. And we cannot also forget about providers, and we cannot overwhelm them with data flow, so they can focus on their work, on diagnosing us and make us healthier, or help us to be healthier.
That's 100% right. I would add something to it, but this little tug of war between all these stakeholders is really something that drives it also forward, right? Because here, this situation puts the most pressure on the back office operations. And also that's why it's more available or more visible in more mature organizations. And the disruptors that are coming in to disrupt the market, they're more, let's say, they're more less risk averse in terms of what they can also offer to the customers, right? And the patients. Because here patients are also able to try some AI features if this is something that brings value to them.
So let's try to put it together, and teams that get this wrong, what does paying twice actually look like in this case?
So this is an interesting thing, because if you get a good idea and you get a good team and you start working on it, and you also get some good people to work with you on it and use it and pay you for using it, then it all looks good. But at the first stage of development, you need to pay for it either way. Whether it's an internal team, whether it's an external team, it doesn't matter. But then again, you face the consequences of what I mentioned before. So your model and your machine learning operations are not adjusted for explainability. So your model drags you behind, and then you need to start over with it, because you either the data gets stale, the model drifts, there are multiple different angles for it to crash. And then there's also the regulatory angle, and you just can't progress further. You need to focus when you have the traction and you have the input from your customers, what they actually need, what you could actually improve to make your product better. You need to stop, and you need to rewrite your basics. You need to rewrite your core, work on the invisible stuff, and provide no value to the new customers or the existing ones, right? Because part of the responsibility of being a disruptor or a newcomer to the market is that you are more agile. You can build along with the feedback that you get, right?
If there's one thing I would like someone building health AI to take from this conversation, it's that trust isn't a feature you add at the end of the development. It's either in the product from the start, or you'll be putting it in later at 3 times the costs. And last thought, what's the one question founders should be asking themselves right now about their AI architecture?
I like how you summed it up. If I were to at least be on par with it, I would say that the question that they should be asking themselves is, do I really know what I'm doing?
Yeah, this is, I think in
It
every
sums it
industry we
up.
should ask ourselves that question all the time. Thanks for the conversation,
That's
Michael.
right. Thank you so much. Have a great one.